Hello, this is Melissa Molinix, the nurse educator at NOPH, and today we're going to talk about LPN duties at NOPH. So the first thing we want to talk about is the nursing scope of practice. We want to make sure that the things that we do are within our scope of practice, and we can find those things on the Ohio Board of Nursing website and also the Ohio Revised Code and the Ohio Administrative Code, because what we're allowed to do, what our license grants us to do, is actually written into state law. LPN roles in Ohio. So the LPN can provide nursing care at the direction of a registered nurse or physician. And when I mean direction, I'm not talking about like supervisory direction. I'm talking about a plan of care that may be executed by an LPN. So practice as an LPN involves observation and patient teaching. It can involve contributions to the planning, implementation, and evaluation of nursing, which is part of the nursing process, which we're going to talk about in a bit. Administration of medications and treatments. Now, at NOPH, that's pretty much all meds and treatments that we do can be done by LPNs. Delegation of nursing tasks as directed by a registered nurse, and teaching nursing tasks to other LPNs and other individuals with whom a RN has delegated you to do. Know your scope. So Chapter 4723-4 of the OAC requires the RN and LPN to maintain current knowledge of the duties, responsibilities, and accountabilities for practicing within their respective scopes of practice and for safe nursing practice. What we want you to do here is practice from the bottom to the top of your scope. So the nursing process, there's 5 steps. There's assessment. We want to gather information about our patient's condition. There's nursing diagnosis, and that's where we want to identify the patient's problems. Planning, that's where we set goals of care and desired outcomes and identify appropriate nursing actions. Implementing, and that's where we perform the nursing actions identified in the planning. And then evaluating is where we determine if the goals met and outcomes achieved. Now, an LPN contributes to all of these steps, and they do that by communicating data or whatever objective or subjective things they find from the patient to the RN or to the doctor. So the following are specific examples of the LPN role contained in Ohio law and rule. The LPN collects and documents objective and subjective data and observations about the client. And we're going to get to that in a little bit more further on in this program. Contributes observations and health information to the nursing assessment. Implements the current plan of nursing care at the direction of the RN or the medication or treatment authorized by the directing physician. Documents the patient response to the treatment plan of care, including medication and treatment. Contributes to the revision of the nursing plan of care. Contributes to the evaluation of the patient's response to the plan of care through documentation and verbal communication with other members of the healthcare team. So how do we fit Ohio nursing law into practice at NOPH? Well, here are some NOPH jobs that may be completed by an LPN. These include, but are not limited to, all oral meds, all IM injections, short-acting and long-acting, all subcutaneous injections, all intradermal injections, basic wound care and dressing changes, antibiotic, antiviral, and insecticide shampoos, soaps, soaks, creams, lotions, and rubs, CPAP equipment setup and maintenance, and patient education. And I'd like to also add, we can also do blood sugar checks and those sort of things. LPNs may call the physician for orders, transcribe, co-sign, and implement orders. So you can call the physician And what I would recommend is that you ask the physician if they could put their orders into PCS. That would be the most appropriate, is for them to put their own orders in PCS. But in a pinch, you can write and transcribe orders. And you want to make sure that you are putting the drug, the dose, the route, the time. You're making sure, checking allergies, right patient, and then you're going to write, because it's a telephone order, TO for telephone order. If it's a verbal order, which could be, you want to write VO for verbal order. And then you put their name / your name. So NOPH jobs that may be completed by an LPN also include focused physical assessment. The LPN scope permits focused assessments, which collect objective and subjective data, and this data should then be reported to the RN. So examples of focused assessment include data collection for all parts of a head-to-toe physical exam, and these include but are not limited to hair and skin exams, abdominal exams, so where we're inspecting the abdomen. Then we're going to listen in the 4 quadrants, or auscultate, and then we're going to palpate the abdomen in those quadrants to check for any sort of tenderness or masses. And we're going to then measure the patient's abdominal girth. Or a clausural assessment, which is basically a head-to-toe exam, where we also check the patient's last white blood cell count check, which can be found in a CBC. And if you don't have access to LabCorp, get a hold of me. I can reset passwords. I can give you access to LabCorp, because you should have that access. And then finally on my list here is COVID-19 screening. So with COVID-19 screening, it's paperwork. We're taking the temperature of our patients, and hopefully by now you've already gone through that training. How this differs from how an RN does an assessment is that the assimilation and analysis of the data obtained and the formulation of the plan of nursing care, that is what the RN's responsibility is. Most charting may be done by an LPN, including but not limited to progress notes, and those could be 7-day notes, weekly notes, monthly notes. Actually, at other regional psychiatric hospitals in the Ohio Department of Mental Health System, LPNs are primary care managers for patients, and they are assigned those notes, as well as other folks in the treatment team. Emergency medication notes, first dose notes, medication refusal notes, and behavioral notes can all be completed by an LPN. All non-licensed duties may also be completed by an LPN, and these include but are not limited to tidying up the unit, safety hallway rounds, one-to-one observations, Q15-minute observations, so those could be the standard or the special observations, passing meal trays and snacks, assisting patients with gait and ambulation, assisting with crisis interventions, vitals, distributing ADLs and assisting patients with ADLs, milieu monitoring, and service desk, like phone calls and passing out sheets and pillowcases, etc. Now, NOPH nursing jobs that may not be completed by an LPN would be adding problems to treatment plans, synthesizing and assessing physical exam data. So if you do a physical exam, you have to bring that data back to the RN, and the RN has to synthesize and assess that data. Ordering restraints. So of course, nurses can't order restraints, but like all nursing staff, the LPN can request the RN assess for initiation of restraints. But ultimately, it is in the RN scope of practice to assess whether to put a patient in restraints. So the RN and the physician are responsible for that choice to initiate and to call, and the RN to assess and call the doctor to order that. So that's been the end of the program. Thank you for listening, and I hope you have a great rest of your day. If you have any questions, please feel free to reach out to your supervisor or myself.